Well, I'm not sure that I would notice the difference, and nor would I suspect any patient or person in the street notice the difference between the funding levels and the type of care they get. What they mostly think is if it's all right and they're fixed and they're back home, they think that's great. That's what should happen.
There is one overriding consideration for every resident of New South Wales. They ask, can I get health treatment or health care when I need it? That's the way I started a speech 10 years ago, and it hasn't really changed. This is an important consideration for everyone. It's for patients, their family and carers, but it's also for clinicians and all involved in delivering health care. It's why I have placed such importance on devolution of responsibility for that treatment to be as close as possible to those who receive it and in the hands of those who will deliver it.
Keeping people healthy and out of hospital, together with the provision of high-quality, accessible clinical services to our local communities, is the core business of New South Wales Health. To support our staff to provide the best possible care, we have been focusing on devolving decision-making, greater clinical engagement, greater transparency of funding and data, and support for new models of care. Now we are moving to focus on how we integrate healthcare across service boundaries to achieve better outcomes for our patients.
Purchasing and performance goes hand in hand, and the service agreement is our instrument for documenting that, for making that clear, for making that transparent. Again, transparency. I guess for setting expectations between the Ministry and our colleagues in LHDs as to what is to be delivered.
With a continued focus on innovation, interactive web-based applications allow users to tailor reports for their own use. These innovations are assisting to identify unwarranted clinical variation, with clinicians using data to lead development in evidence-based models of care. Reducing unnecessary hospitalisation is another key area of focus.
Understanding what we do, who we do it to, and what the outcomes are, and just as importantly is what the cost is, so we can make informed decisions about whether we admit someone into hospital or what the alternative is, so that we can make a decision not only what's best for the quality of the patient care, but also on the price. And if there is a variation, and the assumption is there is a variation, we know we can take that variation and invest in more community-based care.
New South Wales Health also works with patients and families on ways to maintain and improve health. Collaboration, openness, respect and empowerment are core New South Wales Health values. The value of collaboration is critical to all work across the health system and is recognised through awards like the Collaborative Leader of the Year.
I guess in many ways it's a rather strange award to give to an individual. It's very hard to collaborate by yourself, I found.
In keeping with the value of openness, community public forums in metropolitan and regional centres have provided the opportunity for the community to hear about the health system and have their questions answered. Respect and compassion are demonstrated daily through seemingly small but important acts of kindness.
I know there's a policy about introducing yourself, and now at a recent admission for 3 days, I got at least half the people did introduce themselves. I mean, made a real point of doing it.
The empowerment of staff and patients builds trust and the sharing of responsibility through initiatives such as the Patient-Controlled Fluid Allowance Project at the PN Blue Mountains Local Health District.
Yeah, it's a great project and the staff are really heavily involved. They actually instigate all this. They get the folders, and we've actually had patients that have been on the fluid allowance charts before and they ask for it. They go, I want to do my own again.
Health systems need to evolve constantly to benefit from new technologies and treatments and to respond to the changing needs of the communities we serve. Health system sustainability is an important topic for all of us, and I look forward to hearing your views and ideas.